others will join as we go along. Good morning, everybody. Thank you for joining us today after my initial meeting with you earlier in the year in August after I just arrived as the Chula Vista director. Let me put the slides on. So this is my contact information. If you can forward also to other individuals and organizations that might be interested in working with us at the collaborative, phone number and our website. And if you have other employees or staff in your organization that may benefit from the announcements, please let them know that they can subscribe at our website. And we have a tight agenda for you today. We want to welcome everybody and thank you for joining us. We have a chat box that you can use for your notes, questions, and follow-up items that we can do offline. We are recording the session for note-taking and also for uploading in our YouTube channel and our website. And we will be talking a little bit about some highlights from the data of the services that we have provided through our family resource centers and other highlights of the last year with our staff, and just some comments from my in contacting and one-on-ones that I have had with many of you for our next chapter in the organization. We will continue today's program with the presentations from several partners, and they will do a good job in keeping the timing, because if not, I will have to come in and cut them a little bit off. But we are going to forward all the handouts that they have provided, so information will still be disseminated besides the presentations today. We also are going to have some space for all of you, those that would like to share some of your other announcements briefly. Maybe we have time to discuss some of the community needs and challenges that we are facing as this pandemic goes on and our initial temporary plans get kind of expanded and extended and for a foreseeable future. And also a reminder of our next meeting in November. And if you would like to have some time in the agenda for that, for the speakers, you will let me know via email. I wanted to really thank our steering committee organizations because they have welcomed me very fondly and provided support and will ongoingly provide direction to our work and to minimize the double dipping and really working together in the spirit of collaboration to serve the residents and families of Chula Vista. With all of you, over 400 partner organizations that join us or stay in contact with us one way or another. And also a big shout out to the collaborative staff. That is the members of my leadership team at the family resource centers, the Promotores and Promotoras, and all the navigators from our healthcare plan program. I think they are the core of what we are doing, their spirit, their commitment to the work that we do. I really applaud the staff, also for the warm welcome I have received in this 3 months. So just a reminder that our Family Resource Centers is at the core of what we do in terms, and it's going to continue to be as in this new chapter under my leadership. That's why I came here. I share those values of that respect, that customer service, and within these times, still having that the teamwork, but above all, having the well-being of our staff and clients with whatever mitigation strategies we have had to put together to do so safely by wearing masks, socially distancing, monitoring symptoms, washing hands constantly. We do want to continue to stay healthy, to continue serving our communities. And we do so through our 5 family resource centers. Sorry, family resource centers are our locations. And just as a teaser for our annual highlights from 2010-2020, my staff has been compiling all the data, and I want to honor the team that have worked last year with all the families. Oh, sorry. And I wanted to just give you a teaser of the numbers. Pre-COVID, the numbers were amazing in terms of all the families, the students, the individuals, and all the services provided. And we were going to kind of break a record of service numbers even before COVID. Now, after the lockdown, since April to June, the numbers, of course, were decreased because, of course, we had to shut down at some level. We had to reduce the hours, and we had to really take inventory on all the services and be able to do it safely. So with that, still, we were able to continue serving our community with those numbers that you see on your screen. And we continue to provide direct service support to clients in their moment of need, while still being safe and doing so in a way that the staff keeps healthy. So during these months and since the last time I talked to you, yes, we have had to make adaptations given the current situation, both with staff and for the families we serve, always paying close attention to the physical and emotional well-being of our staff in addressing the increasing digital literacy gap that we have seen across the lifespan, from the young to the older members of our families that we serve. We are still going to honor the commitment on our events closing the year with the Adopt a Family and the Santa Shop events. Those I consider many flagships of events of this organization, but also we need to make adaptations regarding the scope and the intensity of those events. So we're going to reduce the number so it will be manageable for our staff at a distance, and with all the precautions and safety concerns. We will still be able to select families for our donors and funders to be able to adopt and serve those needs. And of course, with the toys and gift cards from the Santa Shop this time, if you're thinking of donations to us, we are really focusing on small toys for kids up to 10 years old and gift cards rather for the rest, because it will be less of a burden and more safely handling as a contactless environment that we need to work and operate. In our next chapter, we have I do want to continue with those values and expectations of collaboration and communication. I really value the feedback in many ways that I have received, from phone calls to face-to-face at a socially distanced setting, but also via email. And we can do more of those. And actually, I expect your answers to some quick surveys that I will send out regarding, how to improve the work that we do together under this new environment moving forward. It's not going to go, and we thought at the beginning that it was going to be kind of short-lived, but I think that as we move into a new reality, we really need to see how we can continue to work and even improve and operate outside the box with more specific strategies on how to work together in this new environment for 2021 and all the planning ahead. We have some announcements that from several organizations. Before I move on to the presentation scheduled today, I shared with you and the link in the notification for this meeting, the link to a brief video, only 2 minutes, a little bit more, regarding the future transportation from our friends in San Diego. So please take a look at that. Given that we have several long presentations today, I encourage you to, after the call, can take a look at that video. And also tell us more about your transportation needs in this mobility needs assessment. We have the links available in English and in Spanish of that survey that Sandag put together and received a lot of feedback, and we contributed to the feedback on improving on this survey and making available in both languages. So you are welcome to send those links for your constituents to get a better picture about mobility, especially in this new environment of COVID and using public transportation in different modalities. We have, let me see if Azucena is also here in the call. Maybe she can tell us a little bit more about that. Azucena?
Yes, good morning, everyone. Can you hear me, Brendaly?
Oh, here I have it, her notes from the chat box that you can, are you there? Mm-hmm. Yeah.
Can you hear me?
But we don't hear you.
Okay.
Yes, we can not hear you, but we connected it indicates that there's a lot of echo. So we are going to just leave it with the links there for people to follow up on that survey. Now, we also have a note from an available job from our South Bay Community Services partner, and that link has, let me see, where is it? The blood drive, the resource, plasma. I do have, I think I have the South Bay. Here we go. We have the South Bay Community Services First Steps Home Visitor position description for this job. The link is within the slides that you will be receiving and the notes. I hope that you see it on the screen, the position description. So if you are going to get the link, so it's easier for you to forward that to your contacts. Okay. Let me see what's next. Oh, we have virtual hands-only, also known as a bystander CPR training next Friday on October the 16th. And this is a new development in the CPR training in which no kids or a mannequin is required. Is very interesting. There is a set from the American Heart Association to conduct education about this new type of CPR that is a life-saving skill, hands only. And it will be interesting to take a look at that Facebook event. So follow that link once you receive the slides and get to know more about what a new, different type of CPR is that. Let me see if I have this is the handout that you will receive also. A hand-only CPR digital training on October the 16th. And I'm very interested to know more about this. It's going to be conducted in English and in Spanish and as a Facebook Live event. So I encourage you to take a closer look at this. Now going back to our slides. And I wanted to welcome Margarita Holguin from the We Support You. I know that she has some updates for us regarding the Adelante conference and some free mammograms available for the public. So, Margarita, are you joining us today?
Yes, I'm here. Buenos dias. Can you hear me?
Yes.
Okay, good. So Brendaly, can I share my screen? I think so. Okay, it's coming up. Hope. I think it might be easier if I just share the desktop. It's taken a while to load. I'm just going to share the desktop and pull up the presentation. Okay, can everyone see it? Can anyone see it?
Yes, we can see it.
Okay, perfect.
Yes.
So it's great to be back in a different role. I recognize a lot of the names. So saludos, everyone. I hope everyone's doing well and staying safe with this pandemic. Brendaly had asked me to share a couple of the flyers and announcements that I've sent her to share with you all. So I am continuing to work on various roles. One of my roles is to working a few hours with We Support You. I'm also continuing my role with the City of County Promotores Coalition, and I'll talk about the conference there. I also have an announcement from our work with the Chula Vista Welfare Council, and then I do have my own business now called Consulting Solutions Team LLC. So I just wanted to share a few of those updates with you. With We Support You is an organization that primarily has programs around cancer support. So Berta Tiznado, the executive director, manages all the cancer programs, cancer support, and mammogram events. And we've actually restarting those events as well. And then I manage the community programs, and I'll be sharing about one of those as well. So we have mammogram events starting on next week or so, October 20th. And here's the information. They will be in San Diego. These events are free. We actually have a mammogram van that comes by and is able to do the mammograms on site. So people to completely to do the mammograms, they have to be 40 years or older and have no insurance or be underinsured. People who have high cost of insurance may be eligible as well, meet low-income guidelines, and have not had a mammogram in the last year. So then they would qualify for a free mammogram, and here is the information for the October 20th mammograms. We have a flyer in English and Spanish, and I have sent those out to Brendaly, and so hopefully you all have them as well. And then the next event is the following week on Tuesday, October 27th. And it will be at Family Medical Center, same address there, same qualifications. We just want to provide multiple events. And in these events, it's important to know that if there's any findings, then we do the follow-up, and Berta actually manages that. Sounds like a few people may need to get be on mute. Right. Then I also want to share another program that we have through We Support You now. And this is a partnership with UC San Diego and their Community Health Center for Community Health. And so we are going to be working on a project that looks at Chula Vista and looking at how the environment in Chula Vista can be a healthier environment. So we'll be looking at increasing food security and decreasing obesity. So we have 4 promotoras that are working on this project. We've hired them a couple weeks ago. They've gone through some initial training, and now we're in the process of recruiting a small group of community residents who live in Chula Vista and who are interested in the health environment there and would like to participate in this project. So we will be conducting training for them, and then we'll be working, they will decide on a project to work on to help Chula Vista become a healthier city. This is funding from the American Public Health Association, and it's called Healthy. It's a Healthy Challenge. So it's a Healthy Chula Vista Challenge. So if any of you know of any community residents or yourselves are interested in participating in this type of event, it really will be no more than an hour or 2 a week to dedicate to this project. And that initial training is a 10-week commitment to participate an hour and a half. And then after that is based on the project that we decide to do and how to do that. So we'd love to have anyone in Chula Vista who would like to participate, please reach out to me. And my email's there. Margarita@wesupportyou.org is one of my emails. I have multiple these days. And then I also wanted to mention through the San Diego County Promotores Coalition, we have our annual Allente Promotores Conference, which originally scheduled for August and has been rescheduled to December 3rd and 4th. It will be a 2-day conference, and it's 3 workshop sessions with a total of 15 workshops. Workshops will be both in English and in Spanish, and we will have themes around professional development, health topics, and personal development. We have confirmed our speakers. Our morning speaker is the Consul General de Mexico on day 1, and then we do have another keynote speaker on day 2 that we're waiting to finalize. And most of all, this will be a free conference. So this is normally a conference for promotores, outreach workers, community health workers, peer educators. So please help us get the word out so people start saving the date. We are working on developing a virtual platform, and CVCC is, excuse me, our partner on that. And so we're hoping in a very short period of time, in a week or so, to open registration, and we'll be emailing that all to all of you to help us share the information. And then lastly, through our Chula Vista Welfare Council, we're the group that did food drives throughout the schools and then compiled 600 or so boxes of food to distribute to families and gave them choice as well through Chula Vista PAL. We combined this event with our Santa shop, and we would have the Welfare Council families and the CVCC FRC families in the past to come to those events. So this year, because of COVID-19, we're not able to do the boxes of food at the schools. So we are going to be doing a drive-through give and treat event is what we're calling it. So we're asking people to bring a bag of canned food, and then we'll give them a treat bag for each of their children. So we're also asking for donations of new and unwrapped toys for only younger children, 0 to 12. For the older children, we will be doing gift cards. So if anyone is interested, we'll make sure you all receive this flyer as well. And that's it. I just wanted to share some of the stuff we're working on, and my information's there, margarita@wesupportyou.org, or my personal email as well. If anyone has questions or wants to touch base, it's been a few months since I've met up with all of you. If that's it from me, let me try and stop sharing, and we go from there. Okay, so I have stopped sharing.
Hi, welcome back. I wanted to double check that you now are seeing my slide.
Not yet.
Yes, good. But now we have presentations from the San Diego Blood Bank, Overdose Data to Action, and the Federal Fair Housing Laws Act. And let me try to locate our first speaker from the San Diego Blood Bank.
Hello, everybody. I'm Michaela Mitchell.
Maybe David can open that in his desktop and make this. Do you have that?
And if it's better for me to share my screen, I can try that too if it works.
Yes. Thank you for your understanding. We're sorting out our logistics with our share screens.
No worries. And can everybody hear me just so I can make sure?
Yes.
Yes, we can hear you.
Okay,
Yes.
wonderful. And if I need to go without PowerPoint, that's always an option too. Technology is always fun. And I guess for time, do you want me to start while we figure this out? I just know that there's a tight schedule.
You can go ahead and share your screen.
Okay, wonderful. And I have the capability to do that then. Let's see, how do we do that on this one? All right, sharing screen. I'm not sure if it's letting me. I hit the share screen on the bottom and I wrote present, but it says no one is presenting. This is my first time with Skype presentation. Yes. How about I just start talking and we can just go on the verbal one, and if you can get it up, that would be great. Does that work?
I'll go ahead and pull up your PowerPoint.
Thank you. I don't know if anyone has tips. This seems to be the norm these days on meetings though, right? Right, I see it's loading. Wonderful. I will go ahead and start. I'm Michaela Mitchell, and I'm with the San Diego Blood Bank. We have some overview I'll go through at the beginning, but what I really want to focus on is kind of what we're doing around COVID-19 and also how we and other people in our organizations and that we serve can take action. So I think the one thing to start is, which is pretty incredible, is the San Diego Blood Bank has been around for 70 years this year. So it's our 70th anniversary here in San Diego. We are a local blood bank that serves San Diego County, Orange County, LA County, as well as Imperial. So all the blood that is donated actually stays in our community, and that's what makes us so unique. Could you go to the next slide, please? We'll go down, and those are just some great old pictures. We actually started out with a very strong military presence. The picture in the middle is actually during the 1978 PSA jet. When it crashed, we had a line for people who wanted to step up, and I think that kind of is what shows in our always during times like this. Next slide, please. So like I was saying, we've been here since 1990. We've grown considerably, and we actually are getting units annually. Blood, plasma, and platelets. And again, that goes back into our community. people who live here with us. Currently actually have 8 full-service donors. We're really excited to say we have opened it's a temporary location right now in Chula Vista, but we will be making it permanent. Next slide, please. I always say we are more than just familiar with our blood banking services, but I think are wonderful as we are the only public cord blood bank in San Diego. We also have recently opened the UC, where mothers can actually donate centers or blood drives their milk to be donated to the ICU or the NICU unit in San Diego hospitals. We also do a variety of research services as well as precision medicine. Next slide, please. And again, what I am most excited about is the donation location. It is at the old Sears building, which I'm sure many of you are familiar with, off of Broadway and H. We're currently here for a few months. We'll be there throughout the year. And then hopefully in 2021, we will be moving into a permanent location. So we used to be in National City, and I think it's time for us to be back in the South Bay. Next slide, please.
Just a reminder, if you're online on the phone, can you please mute your mic?
Thank you, David. Wonderful. So we work with a variety of different community partners. I know some of you actually on this call, we have probably hosted blood drives at your site. As you can see, one of our biggest things that we have are college partners. So we have all the universities, we have Southwestern College, who's always participating, as well as high school. With college and high school not in person, that is about 25% of our blood supply comes from those. So we are at a large need with the loss of them. Our congregation partners are still hosting, but again, they're not in person. So we have a need right now for people to step up and donate at our locations as well as host blood drives, just because of what's happening with the current state of COVID-19. Next slide, please. And the next slide that you'll be going to are just some pictures. One of the things we miss most is our signature events. I don't know if any of you guys have been to our Comic-Con drive, which is one of the largest blood drives in the nation. At that drive, you can see Spider-Man donating, many Avengers characters donating. So it is a special event. We also have great partnerships with Padres, as well as the county, to do large-scale blood drives to, keep our blood in our community. If you could go down a couple slides, that would be wonderful. If possible, just go down a couple more. I will, perfect, and go down to one more after that. So this is where we're going to get into COVID-19 and donating. A lot of things have changed. So I'm not going to read these current procedures, but I do want you to know that we are taking this seriously, and we have a lot of policies and procedures around safety and cleanliness. So whether if you're donating in one of our donor locations or at our blood banks, we have taken all of our FDA regulations, and we're taking it seriously by increased disinfectant, less number of people. We're currently doing appointments only to ensure there's not too many people congregating. So we have more of that information on our website as well. Moving to the next slide, please. Also, can we donate? It is time of COVID, so things are a little bit different. I will let you know when you get to our donation station, you will have your temperature taken and you'll be asked a few questions. So basically, if you have not been out of the country in the last 28 days, other than Baja, Mexico, you're good to donate. And we also screen people for respiratory symptoms. So even if you have allergies or not feeling good with the sniffles, you're not able to donate, as well as asking if you or anyone who's been close to you have been diagnosed or suspected of having COVID-19. So those are our main deferrals. Also for donating now, it's the same as always. You still have other qualifying questions and registration you have to do. Next slide, please. So this is what I really wanted to talk to the group about, convalescent plasma. I'm not sure how many of you guys are familiar with convalescent plasma, but it is now being used as a therapeutic treatment to COVID-19. It is not an approved drug yet, but it is in the trial process, but it has been being used around the country, and there has been really positive, positive things that have come with that. The reason that it works is in our plasma, it has rich with our antibodies. So if we have already recovered, the antibodies are in our plasma, and then we can give that to somebody else to help kind of bump up their antibodies as well. Convalescent plasma, it's pretty interesting. I thought this was like a very cool new thing. It turns out that they have been using this for the last 100 years, specifically Spanish flu, SARS, MERS, and swine flu as well. I don't know if you've donated plasma. It's the same process as regular plasma with donation, a little different than blood donation. It takes a little bit longer, about 75 minutes. And what happens is they take all of your blood out, they save the plasma, and then put the platelets, the red blood cells, back into you, so you're doing okay. So that's a little bit about convalescent plasma. Next slide, please. And I just wanted to share a story of a Chula Vista family who really paid it forward. The Barajas family wasn't feeling well. They were quarantined as a unit, and it turns out that they did have COVID-19. Unfortunately, their daughter, who's 19 years old, Maya, she wasn't doing as well as everyone else. So she ended up having to go to Sharp Memorial in the intensive care unit. It was looking pretty bad for the family. When this was happening, her mom, Marilena, wanted to do something to help her. And she herself actually found convalescent plasma and reached out to us to donate. Luckily, we already had convalescent plasma on our shelves from another donor in the past that they were able to give her daughter immediately. That was kind of when the family saw a turn for the better with Maya. So because of that, Marilena has donated convalescent plasma multiple times to pay it forward to other community members. Like I said, your donations here, it will stay here. It could very possibly go to one of our community members in Chula Vista. So I think it's just kind of important to put a face to that. Next slide, please. We would love to get the word out about convalescent plasma. A lot of people don't know that. We have been hit very hard with COVID-19, specifically in our region in Chula Vista. So for all of you guys to help get the word out, that's kind of my big ask for today. For the qualifying, it's a little bit different. You do have to put in an interest form online, which is sandiegobloodbank.org/donate plasma. There'll be some qualifying questions, and some of them is you do have to have a positive test, including a positive antibody test, and have not had symptoms for 28 days. Again, there's some other ways that you can do it if you have not had symptoms for 14 days and have had a negative test as well. Again, if anyone has questions, feel free to reach out directly to me or go to our Donate Plasma page. So moving on to the Take Action and Save Lives, what can we do right now? I know this is a time where all of us kind of want to help, right? In some way or another. It's a hard time. So one of the ways that I say to do best is donate blood. That's giving a life. So for you and for your communities, if you can just let them know that we need blood more than ever right now. We also need blood drives. So if there is any organizations that are still able to host, we would love to host at your site. We really only need a parking space as well as access to a restroom, and the rest is self-contained in our mobile. Also, you could host a virtual blood drive with your organization. On the next page, I'll show you a little bit about what a virtual drive looks like, and that's basically just getting the word out and saying donate in behalf of our organization. So if you can go to the next slide, I put together a flyer for our Chula Vista Community Collaborative. So I'm doing an ask for you guys to go out and donate at one of our 8 donor centers or blood mobiles. And if you do donate, say the name CV20. That is our code, and that way next meeting, I can let you know how many lives that we saved as a group and an organization. And I can also pass this flyer on to you to go. Like I said, there are some blood mobiles in the area coming up. We've got these ones listed here. Vaughns at Eastlink is tomorrow. First United Methodist off of 8th Street is on the 16th. Sharp Chula Vista, and also our new South Bay donation location, which I spoke about earlier. Please note, we're open from Tuesday through Saturday on this location. So sorry I talked fast. I wanted to stay on track, but I do want to open this up now. Does anybody have any questions for me? And if not, you feel free to send me an email or give me a call. That is my cell phone, so you can reach me during these times. And thank you all for this time. I really appreciate it, and I'm happy for us to all be together in a virtual format. Wonderful, thank you.
Thank you. Thank you for that information. We do want to encourage our partners to work with Michaela and finding opportunities to the house tour drive and use that flyer. And she will be sending us information about how did it go for our next session. Now we have another presentation regarding fair housing essentials. And the speaker today, can you identify yourself?
Yes, good morning. This is Matthew from CSA San Diego.
Hi, Matthew. Good morning. I have your presentation here, and also we will forward the handouts that you provided alongside with the slides. And let me set the presentation out in presentation mode. And you will let me know when to move forward.
Okay, perfect. Sounds good. So, Brendaly, thank you so much for letting us speak this morning. Certainly, it's great to be meeting virtually. I know I'm actually new to this position and was hoping to meet everybody a couple months ago, but glad to be here now. So I'm with CSA San Diego, and we focus on fair housing. So I'm just going to go over a general overview of what we do and what fair housing laws are. But what I would encourage is that if there's something specific to your community organization that we cover, reach out to me and we can kind of talk more specifically about how we can work with your communities to really ensure that housing is fair for all of the residents in San Diego County, especially now with COVID. Things have become quite precarious in a lot of different ways. So I'll go ahead and kind of move forward in talking about what we do, but keep that in mind that if there's something specific you think is affecting your communities, feel free to let me know and I'll put my information in the chat as well for you to contact me. But CSA, we are a nonprofit HUD approved agency. We have over 50 years of experience as fair housing advocates. So we address discrimination in housing, but we also look at rental counseling and do a lot of mediation between tenant and landlord issues. So with that, a lot of times there will be a tenant-landlord issue and the person won't realize it's discrimination. We kind of talk through those situations and figure out if it is discriminatory or not, and really work towards developing resolutions for those types of issues. In addition to fair housing, we also provide hate crime prevention, human trafficking prevention, and civic engagement. So we're really in a number of different buckets, but today, of course, I'm going to talk about fair housing and why that's important. We can go to the next slide. I'll just talk real quickly about our mission and kind of why we come to work every day. And so we're a nonprofit, and our primary mission is the promotion of social justice and public welfare through different programs and advocacy against all forms of discrimination. This includes the eradication of housing discrimination because we want to ensure equal housing access and opportunity for every single resident here in the San Diego area. So we're really committed to promoting and enforcing the fair housing laws and equal housing opportunities. So fair housing laws is not something that everybody thinks about every day. but certainly now with COVID, we want to make sure that landlords and residents are definitively thinking about what fair housing laws are. So within the Fair Housing Act, there are 7 protected classes federally, and I'll talk a little bit more about California specific laws here in a second. But what I would say is that if one of these protected classes is specific to your community organization, please reach out. We would love to kind of speak with you and figure out how we can ensure your community members are aware of their protections. So go back one more slide real quick. So we focus on race, color, national origin, religion, sex, familial status, and disability. And what that means is that any individual cannot be refused housing or provided different treatment on the basis of any of those factors. So, for instance, if somebody is perceived as being of a certain religion, whether or not they are, and they're receiving different treatment because of that, that would be discriminatory actions that would be protected under the law. So these are the 7 federal protected classes that are really important to think about. And then we can go to the next slide, and I'll talk more specifically about kind of California extended protection. So California has extended additional protected classes, including sexual orientation, gender identity and gender expression, marital status, medical condition, ancestry, source of income, age, genetic information, and arbitrary discrimination. So arbitrary discrimination really covers anything, any physical attributes, so difference of treatment because of, say somebody has tattoos, right? That would be covered under arbitrary discrimination. So we're going to touch on a couple of these later on in the presentation. I do want to give some examples of really describing what housing discrimination is. And so that includes blocking someone's access to housing or treating one renter or buyer differently, or denying someone the right to buy or rent a home even though they can afford the property, all because a person is a member of a group or protected class. So really, here we're looking at difference of treatment. So if there's a difference of treatment because of a protected class group, then discrimination is happening. So the Federal Fair Housing Act covers most housing. There are a few exceptions. That's why if anything comes up, we encourage people to just contact us and we can walk through the specifics of what's going on if it is covered by the Federal Fair Housing Act. But like I said, we also focus on tenant-landlord issues and usually try and kind of resolve issues whether or not we pursue the law in that sense. So there are some exemptions if it's a religious organization. There are some exemptions there. If it's less than 4 units, there might be some exemptions. But again, like I said, contact our office. We can work through a lot of landlord-tenant concerns and really try and see if we can come to a resolution for all parties. So these are just a few examples of prohibited conduct. Harassment is one that kind of people don't really think about, but is really important. If somebody's receiving harassment because of their sexual orientation, because of their perceived national origin, whatever that might be, that harassment might be qualified under the Fair Housing Act. Some pretty clear examples include refusing to rent or sell to somebody because of their protected class. We'll talk a little bit about steering here in a second, but advertising a preference is also something that's not only frowned upon, but illegal under this Fair Housing Law Act. Next slide. So just some more examples, lying about availability. Sometimes we'll see this where somebody will say, oh, we don't have any availability right now, but then somebody else will come in of a different protected class group, maybe of a different race, and then they will say, oh, yeah, we have availability. And so with that, we do conduct testing as well. So one of the things that we do is we go out to different rental organizations and we will do testing where we have people of different class groups inquire about an apartment to see if there are differences in treatment in that application process. Next slide. So there are some clear explicit examples of discrimination, right? So obviously this sign here says we want white tenants in our white community. That's obviously pretty explicit discrimination. Some of the things that go unnoticed that are more subtle are intimidate someone so that they won't file a complaint of discrimination. Sometimes there will be ads about different religious organizations nearby, and that's something that can be considered as saying, we want somebody who is Jewish to be living here, or someone who is Catholic to be living here, and then discouraging other individuals from other religions to actually apply to that housing facility. So these are some examples of kind of the subtleties that do happen. I want to jump into familial status. This is one of the protected classes we see quite often within the San Diego County area, that couples with children will be denied housing because they do have children, or receive some type of different treatment. So a family is defined as to be protected under this familial status. Anybody with individuals who are under 18 with a parent or guardian in legal custody. So this includes women who are pregnant. We do see a number of cases where a woman becomes pregnant and then the landlord begins treating the family differently, might end their lease because they're, quote, now too many individuals are in the same place. And so that's where we really have to think about. And the other example is adopting. So if a landlord finds out that a family is adopting or fostering children, that becomes protected under the familial status class as well. So really the idea is to treat all applicants equally, treat all tenants equally, whether or not they have children in the familial status. Next slide. So with familial status, the other example that comes up is steerings. And so what steering is really a landlord saying, well, wouldn't you like to live here instead of here? And really the idea here is that individuals who are applying for a rental space or a house should be the ones to make the decision where they want to live, rather than the landlord or realtor making that decision for them. So we see this often with familial status, where a rental property will say, oh, well, we put all of the families on the first floor, or we want all the families near the pool area to kind of keep the noise over there. Those are specific examples of where steering becomes discriminatory, because it is focused on putting particular groups of protected classes in particular areas. So with that, I want to move on to disability. This is another very common complaint of discrimination. And so the difference with disability is that individuals who have a physical or mental impairment that really limits a major life activity can request reasonable modifications or accommodations to their property, or to make those requests to their landlord in order to more fully enjoy and engage with their living facility. So this would mean that they would actually, through that accommodation, then begin to receive equal treatment in that facility. So one of the things that comes up is that disability also includes those who are recovering from drug or alcohol abuse. That sometimes gets confused, but that is a disability under the law. And the other thing I will add is that now HUD has indicated that COVID is a disability, is considered a disability. So what that means is that if somebody has COVID and they're not allowed to leave the house, they're in quarantine, or they're living with somebody who and need to be quarantined or have been exposed under quarantine, they may be able to ask for accommodations to ensure that they can stay quarantined. For example, if they're having to move out for some reason or another, asking for that extension of time. And I'll talk a little bit about rental moratoriums at the end here, but specifically those accommodations can look like a number of things. So if they need somebody to, Amazon to come in and drop off their packages to the front door, whereas previously they were having to go down to the mailbox, those are accommodations that could be requested because of someone's disability, specifically with COVID. So I'll give some more general examples in the next slide. Oh, perfect, we're already there. Of kind of just some general reasonable accommodations. Sometimes somebody will be receiving a disability check. They'll need to pay rent on the 5th instead of the 1st. That's a typical example of an accommodation that we see. Sometimes modifications will be needing to put in grab bars into the restroom. Those are allowable under law, depending on if it's a HUD funded agency or not. The payments might be different of who pays for that, but by all measures, an individual with a disability should be able to ask for that modification. Sometimes they need to ask for a cosigner. So as you can see, if somebody has a disability, they should be able to ask for some types of accommodations to the regular rules as they apply to make sure that they're able to enjoy that facility. The most often one that comes up is emotional support animals or service animals. Even if there's a no pet policy, individuals with assistance animals are allowed to have those assistance animals under this law. Next slide. So the last protected class I want to talk about here for today, I know we're kind of tight on time as well, is sex. So sex or gender. So now with COVID, we've actually been seeing an increase of sexual harassment concerns where because people are unable to pay their rent, they're being asked to pay in other ways. And that, of course, is illegal under the Fair Housing Act. So if somebody is experiencing this or experiencing some type of pressure, quid pro quo type of concern, they need to call our office and we will walk through that process with that individual to make sure that they're protected under this law. And then just real quick, the other thing that we've seen an uptake in is national origin cases because of COVID. A lot of landlords are saying, oh, well, you're coming up from Mexico and bringing COVID with you, and therefore will refuse to rent to somebody or harass somebody on that basis. And that is discriminatory under the law, under two statutes, one national origin and also the perception of a disability. Again, you don't necessarily have to have a disability, but if you're perceived as having one, you would be protected under this law. So with that, certainly if anything comes up regarding kind of any of your clients or you want us to speak to your communities, please feel free to reach out to us. We are available to kind of talk through any of these issues about the fair housing laws, but also counseling on landlord-tenant issues, right? So if there's a difficulty that comes up between a tenant and a landlord, we do mediations for those individuals. And we also offer services in English, Spanish, and Arabic. And our goal is really to provide resolution for these situations. The other thing that we're working on right now is we have a new COVID grant, so we're looking to speak to more of the COVID-specific issues that are coming up. I am providing a fact sheet on the new rental moratoriums, which will kind of outline more specifically the rights of all residents here in CSA, in the County of San Diego, regarding their ability to stay in their homes despite COVID difficulties in payment. So right now there are kind of two laws, the federal law and the state law, that are kind of up in the air, but that fact sheet will kind of outline what the rights are of individuals. And what I would encourage you is that if you have any questions or there's a concern about a fair housing or rental moratorium issue or COVID issue, to reach out to us. And again, let me put my information in the chat, but I'm also sending a flyer out with our information. So really that should kind of, we would be able to look at any concerns you or your communities have, but we're always willing to do trainings for anybody in your community to really talk about what their rights are as it relates to fair housing and also landlord-tenant concerns. So with that, I will open it up to questions. Are there any questions? Okay. Just a quick note, we do have a couple events coming up. We're going to be joining Blind Spot Collective for Good Trouble this weekend in Chula Vista. That'll be Sunday at 4 o'clock, I believe. So we'll be out there participating in their performance. And then we are starting to do some home buyer workshops. And then we have a specific webinar on November 5th. For housing service providers. So if you know of any property managers or landlords or renters, that are looking for some more information, that is a free event. And, they're more than welcome to join us there. So with that, excellent. I will close it out there. Thank you all so much.
Thank you for that. We're going to transition on to our next PowerPoint. Give us 1 second.
Hi, this is Rain Hinkie-Ledwith. I don't know if you can hear me or not, but is there any way that I could share my screen to do my presentation?
Yes.
Also, there's a lot of typing in the background. Do people mind muting, please? So David, am I able to present? Do I have permissions?
Yeah, you should be able to. It should be right. Should be the button next to the mute button.
It just says no one is presenting, and it doesn't let me manage presentable content, I guess. Oh, wait. I think I can now. Okay, here we go. I'm sorry, this is my first time using this platform, so I apologize for the delay. But it's loading.
Sharing our screen.
Hi, yeah, it seems like it's taking a little longer. Is it okay if I just take over the slides for you?
Okay, do you mind putting it in full screen mode though? The screen or the slideshow mode, just so the slide is full screen and doesn't show like notes in the next slide. Yeah, it's still loading, so yeah, it's just not working on mine, I guess.
Yeah, so just go ahead and stop sharing.
So do you mind putting it in slideshow mode instead of presenter mode so it's full screen? I think if you just click on that screen icon next to the search icon, maybe that would do it.
So let's continue. I think that this is what we can do now.
Okay. Great, thank you. So my name is Rain Hankey-Ledwith. I'm a prevention specialist at the Institute for Public Strategies in the South Bay. The Overdose Data to Action project is a result of the CDC grant of the same name. And before we dive in, I just wanted to say for anyone unfamiliar, opioids are substances derived from the poppy plant or chemically manufactured to imitate the poppy plant. So heroin, oxycodone, Vicodin, and fentanyl, those are all opioids. So the Overdose Data to Action grant is aimed at addressing the opioid epidemic through research and various prevention strategies. You can go to the next slide, please. Thank you. So just a quick overview of IPS. The Institute for Public Strategies was founded in 1992 using a unique upstream approach to prevention that examines the broad conditions that impact a community as they relate to health. We just adopted a new mission, and that is that we work alongside communities to build power, challenge systems of inequity, protect health, and improve quality of life. And I included our ACT model here. This is how we approach our community work. Oh, you can go back, actually.
We're going to have to move forward very fast.
Okay, you can skip to the slide 5 then. Can you skip forward to slide 5, please? Thank you. So some of our project goals briefly are to destigmatize opioid use disorder and medically assisted treatment, increase awareness about opioid use, misuse, overdose treatment, and other related issues through verified data, engage residents, so reaching out to diverse community groups. So thank you for being here. And also engaging youth and raising awareness about opioids among youth and empowering them to educate each other. I don't think we have time for the next slide, so you can just skip that one too. Okay, I'm sorry, the slide is a little messed up.
Oh, there it is.
But
I was just gonna...
we can just skip this one too. If you want to skip this slide, that's fine.
The participant list.
I don't have a...
Okay. So basically that last slide was just an overview of the US in general, but we're just skipping forward in the interest of time to San Diego Opioid Trends. So this is from the California Opioid Surveillance Dashboard, which is also part of the Overdose Data to Action grant. And the crude mortality rate from 2018 was 8 per 100,000 residents. And so that is lower than other states in the national rate, but unfortunately we have seen a 5% increase from 2016. And I think you can barely see the graphs on the left, and that is the prescription opioid, heroin, and synthetic opioid death rates, and we can see that they have gone up since 2016. So you can go to the next slide, please. Thank you. So another IPS project, Partnerships for Success, that aims to reduce substance misuse among the Latinx population in the southern border region of San Diego County, created this heat map. And the heat map just shows 5 years of opioid-related deaths by zip code. And as we can see, the larger concentration of that is here in Chula Vista. You can skip to the next one. And then I also wanted to highlight another resource, which is the Prescription Drug Abuse Task Force. So they put out a report card every year, and this is a graph from their 2019 report card. So we can see that the three opioids that are the largest culprits of accidental death are heroin, fentanyl, and codeine. You can skip to the next slide, please. So in terms of unintentional fentanyl deaths, this opioid has really exploded in the last couple years, and there's a huge jump from 2016 to more recent years, and that's largely due to the trafficking of illicitly manufactured fentanyl. Next slide, please. And I wanted to briefly touch on fentanyl during COVID. So we have some preliminary data from the San Diego County Medical Examiner's Office. And unfortunately, what we're seeing is that we already have 3 times more fentanyl overdoses at this point this year than we had at the same point last year. And that is largely due to the increase in trafficking, and also the compounding stressors of the pandemic have also been cited as likely contributors to this trend. So you can go to the next slide, please. So there's been a big increase in trafficking, and from preliminary data that we have from the CDC in 2019, this illegally manufactured fentanyl was responsible for about 3/4 of the opioid-involved overdose deaths. Essentially, because the fentanyl is so highly concentrated, it can be transported in small quantities, and it generates significant profits. So it makes it very attractive for traffickers, and then equally, it makes it very dangerous for users. And it's become such a problem that the DA's office put out this community alert recently. I like this flyer because it shows you visually what a fatal dose of fentanyl is. As you can see, it's such a small amount. And for that reason, when we have illegal trafficking that's creating fake oxy pills or putting it in powder, obviously with the lack of regulation, the dosage has a higher risk of being off, and that's why we've seen such a spike in fentanyl overdoses. Okay, you can go to the next slide, please. So we don't have too much time today. I just wanted to give you kind of the brief overview of the crisis and a little snapshot of the current situation. And I wanted to highlight one of our prevention strategies, which is safe disposal of prescription medication. So this is just a snapshot of one of the videos that we have called Socially Distance from Your Unused Meds. And if you want to follow our socials, we're always posting content like this, relevant resources and upcoming community events to strengthen communities against substance misuse. You can go to the next slide, please. Yeah, I'm sorry, in this format, the slides are a little messed up, but I wanted to highlight 2 other statewide initiatives. So DEA Take Back Day is the most upcoming, and that's October 24th. It's free, it's safe, and it's contactless and anonymous. So you can literally just drive up to these locations, drop off your unused meds, and that's it. So it's deaTakeback.com. It's a really easy to use map interface. And then the graphic that you can't see underneath that is another statewide initiative. And this is all in the resources slide that will be emailed to you. But the other statewide initiative is don'trushToFlush.org. And I like that they named their URL that because it reminds us that just simply flushing meds down the toilet is not a safe way to dispose of them, because then they get into our waterways. So the best way is to go to these certified collection bins. so we can protect our people and our waterways. And here in San Diego County, we have the Prescription Drug Abuse Task Force at pdap.org. And I really like all of the easy to use flyers that they have at their disposal, kind of the do's and don'ts of safe disposal. And then if you go to the next slide, they show all of the regional medication safe disposal sites. So this is in the South County, but they have regional flyers for all of San Diego County, and they have them in multiple languages too. So I definitely encourage people to take advantage of that. You can go to the next slide. So I know that was a lot of data and information just kind of thrown together, but I just wanted to repeat the action part of this data to action project. Again, we're really emphasizing safe storage and disposal of unused or expired prescription medications. And then I want to highlight again our overarching goals of destigmatizing opioid use disorder and destigmatizing seeking treatment, like medically assisted treatment. So the number one way we do this is by going into presentations like these and sharing that info with others. But also, I don't think you need to be an expert to have a conversation with your family, your friends, your neighbors, or your coworkers, because that all contributes to the breakdown of the stigma. And you never know if that'll open the door to somebody seeking treatment for themselves. If you want to go to the next slide, please. And lastly, we always promote the San Diego Access Crisis Line and 211 as a good place to start if you or someone you know need help addressing a substance use disorder. So thank you very much. My name is Rain Hank-Ledwith. I work at IPS South Bay, and you should be receiving some resources via email. Thank you.
Well, I wanted to thank all the speakers today, and we will be forwarding to everybody the handouts that were provided by the speakers today in PDF form and as a link.
Hello? Hi, Donna.
And I will be doing a little bit of follow-up myself with all of you, gathering some of your community needs and challenges. We have a need to kind of put together some of those thoughts on our challenges, our common challenges servicing the communities during the COVID. And that will inform some of our next steps, especially working with our next year coming up on 2021. I really urge you to get to know more, learn about what everybody's doing, sharing the results of the work, and continue keeping connected and being involved. Our next collaborative meeting is on November the 10th, right after, before Veterans Day, and we'll have another one on December the 8th. And within the next 2 months, we will be very busy with our Adopt a Family and Santa Shop events and Thanksgiving food distribution. Again, for donations, it will be contactless and putting together a lot of gift card packages as we want to maximize the opportunities for this type of virtual interaction, but also being safe with our staff with all the mitigation strategies we have put together at our family resource centers. And coming closer to the end, I want to really thank everybody for coming today, for being patient with us as we moving into this virtual environment. I hear so many wonderful stories about how these meetings went in person, everybody coming together, seeing familiar faces, new faces, and welcoming new programs and dissemination of all the strategies that we put in place to better serve our community here in Chula Vista and across the county of San Diego for many of you. So definitely it has been a change, and I appreciate your patience with all our technical hiccups. And I'm sure that some of you may relate as you also connect with your stakeholder partners in different ways and within this virtual environment. Feel always free to give me an email or a call. We want to keep everybody safe, properly wearing your face mask, doing your social distancing, washing your hands frequently, and avoiding large gatherings. We can do this together. So thank you so much for joining us today. And you can right now take some time to put in the chat box information about your organization. We still have a couple of minutes, so maybe someone is interested in sharing something, but if not, use the chat box. It will be shared with the recording of this call. Thank you so much. And the meeting is adjourned.